guys, welcome back to Medical Coding with Blue. Today's episode is all about, does prior medical coding experience count if you are not yet certified? If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so I got a question about this in a very good email, so I'm going to read the email and we're going to get into it. So here we go. The email says, "Hi, I've been watching your YouTube videos, which are very helpful, and wanted to get your input as a professional coder. It's been 5 years since I've entered the dental field. I started off as a dental assistant / clinical lead, and for the last 4 years, I have been a dental coder for 2 dental practices. Recently, I have been interested in medical coding and getting my CPC. I called AAPC and they said my dental coding experience will get the A removed. And I wanted to start medical coding because I'm getting burnt out working for just dental only. I am aware that there are many jobs out there, but I am nervous that my previous dental coding experience won't be recognized as coding experience, and I will have to start from the bottom, making way less. Because the number one thing I see in the comment sections is that it's hard getting a position as a new coder, and I don't know if those people are starting fresh into getting into the medical field, or if they are like me, who already has medical coding field experience, just dental, or coming from another medical department. All right, so here we go. Yes, your experience absolutely does count as medical coding experience even before you are certified. The individual called AAPC and they even said that they wouldn't have to have the apprentice status because they have enough work experience. The thing about dental coding, and just because you say, oh, it's just dental coding, you are still coding for diagnoses and for procedures when you're coding for dental in the dental setting, right? It's not like being in risk adjustment, where risk adjustment coding or HCC coding is solely diagnosis coding. There is no procedure coding. There is no evaluation and management coding. So that is already, having the coder with a very limited experience, if that's what they do. And many years ago, risk adjustment people didn't even have to be certified. Now with the popularity of the CRC, which again is just only covering diagnosis coding, which you're already tested on diagnosis coding when you take the CPC. But when you're already tested on it, right, you're just sort of doubling up now. But it's a more popular credential because people are selling that in the programs now. And so that's the push for this credential out there. Guys, you don't need it, I'm just saying. But here's the thing, when it comes to, are they going to recognize this as experience? I have seen employers say that if your only experience has been in risk adjustment, that they do not count that as experience. Now, I was surprised because I was like, wow, but it makes sense, right? Because you're not seeing anything with procedures, you're not seeing anything with evaluation and management. So it does impact the coder's ability, right? And there's a lot of people who get jobs and then they stop studying, which is why I'm always telling you guys that you do need to study. No matter, where you are in your career, you still need to study, because that's the only way you're going to be able to get out there, and you're going to be able to be as versatile and have many more opportunities versus somebody who does not study. So with that being said, minimizing your experience, even though you have not gotten your certification yet, is a bad thing. You don't want to say, I'm just a dental coder, or I just did this sort of coding or that sort of coding. If you are actually coding, meaning that, and I have to be very clear here, coding, when I say coding, because sometimes nurses will write me and tell me, well, Blue, I've been coding. And then I ask them, what do you define as coding? Well, we have a sheet of all of our diagnoses that we use. No, that is not coding. Coding is actually looking at the documentation and then getting the diagnoses out of there that the provider documented well, the procedures as well, or correcting those diagnoses that are already pre-selected, or the procedures that are pre-selected to the correct code. That's coding. So either you're abstracting or you're actually just auditing to make sure that everything is okay. And if it is, then good, But if you are just sitting there selecting from, we always do this, and this is what we're doing, That's not coding, guys. You have to understand there's a difference between the two, all right? And so that's the thing that you have to know. Anytime that you have experience like this individual does, where they're doing a lot of those procedures for dental, and of course they're having to pick up diagnoses, don't minimize that experience. You need to expand on that experience, especially when you get out there in the real world. You know, having the CPC is going to be like a feather in her cap now, where she can say, well, I've been doing all of this dental coding, I just got my certification, and now I'm trained to do even more different types of specialties. But you're already in the system. You already know, meaning you're in the system, but you already know how to use an electronic medical record. You know how to protect the patient information. You know how to look at the documentation. You know how to abstract. You know how to audit. And those things are very important. That's what you want on your resume. So don't minimize the fact that you've had all of this experience in dental because you think that you're going to have to start from the bottom. I doubt it, especially when, you know, they're always asking for experience, and you clearly have experience. Even though you've been in dental and even though you have not had your certification, it still counts as experience. So just make sure that if this is you out there, if you are in this situation where maybe you're not coming from a dental clinic, but maybe you're coming from like a pain clinic, or maybe you worked in an orthopedic clinic and you did the coding for them there, but you were just hired on as a secretary, and then all of a sudden you just had this role of being in the coding part or even in the billing part. That's still transferable skills. Don't think of yourself as somebody that's brand new. The people that talk about the fact that they can't get a job and they're saying, well, I went to the school and I can't get a job, those are people who are brand new with no experience background in medical at all. So those folks are going to have a hard time because they don't know the things that people who are coming in from the medical field do know, like about the electronic medical record, or, you know, the other processes that go on in a medical office. So don't listen to other people when they're out there complaining, because there's a lot of people that complain about not being able to get work, but they're also not saying why they're not able to get work, because sometimes there's a few reasons why people cannot get a job, but they're not going to share this with you. They're going to say that medical coding is the villain and the industry is the villain and they're the innocent victim because they're not telling you that they can't pass an assessment test. That's number one. If you are given an assessment test and you can't pass it, do you, as a business person, would you want to hire somebody who cannot pass even though they've passed a certification exam? Wouldn't that make you a little bit suspect, like suspicious, you know? And where you're thinking, okay, you passed a certification exam, but you can't pass an assessment test with us? Were you only taught how to pass the assessment, the certification exam? Because if that's the case, then it's on the individual to make sure that they are studying with those books that I've recommended at least. And, you know, there's a lot of resources out there for medical coders that are free. So that's something that, you know, if a person is really interested in that, they will make a way and they will find out how they can get better so that when they are taking these assessment tests, they can pass and they can get that chance to get in. The second reason is they can't pass a background check. There's a lot of people out there who should have never been allowed to go through a medical coding program. But there's a lot of medical coding programs out there that want your money. That's the thing. They want your money. It is a very difficult field to study because we have to know what doctors know while never having gone to medical school. And sometimes these schools take advantage of people. Oh, well, you know, that they have a criminal record and they're like, well, you know, it'll be okay. Some things, if you have a record, some things are understandable by the employer. However, there are things that you cannot. I mean, if you have a problem or if there was an issue with identity, no, you cannot. That's an absolute no-no because we are dealing with private information. The other thing is if there's any kind of violence or anything like that, again, that's a no-no. We can't have that in the industry. So there's a lot of people that are going to run up against that and not say. The third thing is they cannot pass another type of screening where they have to send you in and you have to take a little test, a little tinkle test, and they can't pass that tinkle test. I'm just saying, guys, that's something that It's the reality of the situation, which is why I always tell y'all, don't listen to other people, especially the ones in these horrible Facebook medical coding groups, that they think they know everything about the industry and nobody wants to hire me. It's not easy to get in. Number one, it is not easy to get in. It takes a fighter to get in. It takes somebody who has the stomach for the fight to be able to get in. It takes somebody who listens to sound advice, especially when I'm somebody who has been there, done that, got a t-shirt. And I tell you guys, get registered with a temp agency. You know the hue and cry that I get. I don't want to do that. I want a real job. Do you think that I said the same thing? Of course I did. I said the exact same thing. I said, I don't want that. I want a real job. But every single assignment that you get put in for a temp agency, that is going to add to your resume. Now you have experience. Now you're going to start to learn more things. And so these are not little one-day assignments either. Okay, so don't make no mistake. These are not little one-day assignments. These are like usually, sometimes they'll be for a contract, so it'll be like a few months. And sometimes you'll get called to work at a hospital and, you know, somebody's on leave or they need help with backlog. And so all of that time you get to add to your resume. So that's something to keep in mind, guys. You have to keep an open mind, especially when you're trying to get in. There are no, experience requirements with temp agencies typically. Why? Because a temp agency's job is to get you a job. So they will be proactively trying to find you a job while you are trying to proactively find a job. So with that in mind, then you have double the looking power, right? They're going to make sure you get a job because if you're making money, they're making money. And that's the name of the game. So that's why I say get registered with a temp agency so that way they can help you. I got my first job through a temp agency, which led me to my second job with a temp agency, and the money went up. And that last temp agency job that I had led me to my forever home because I was still applying because I wanted to get back to my hometown. And that was what I did. You know, I got as close as I possibly could, but I made it to my forever home. So that's the thing, guys. You can't just take what other people are saying and say that that's going to be you, because obviously it's not. Somebody who has prior coding experience is going to be more looked at than somebody who is brand new, who doesn't know anything about the field. And those people, a lot of them, they're saying that, you know, they have no experience. They're not like you with experience, where, you know, if you have all of this stuff that you did before, these are transferable skills you can bring in. But I don't want my people that are out there who have no experience to get discouraged. Don't be discouraged by this message. Let it motivate you. Because for those people that are coming in, even with medical experience, a lot of times they don't know how to put it down on a resume that is going to show that transferable skill. They don't know how. See, that's where people who listen to sound advice are going to end up, you know, with a better chance. Because if you look at any of my videos where I talk about resume tips for brand new medical coders, you will see, I posted a comment the other day from an individual who said that they used all the tips that I gave on my resume tip video, and they also used my tips for interview, and now they have their job at their forever home. Guys, I'm not sitting here trying to hear myself talk. I'm trying to help you all out. All right? So don't take everybody else's experience as your own, because everybody's an individual in this, and everybody's going to have a different journey. Everybody's journey is different, but trust and believe it is difficult for everyone in the beginning. All right? So take your experience. If you've been a coder before, or if you've done the billing before, make sure that you put those points in your resume so that way the employer knows, because they don't know you from Adam or Eve. They don't know you. So you can't expect them to just assume your knowledge base and what you know. A lot of people will leave off of their name their credentials, and that's a big no-no. That's a red flag too when I see that, because I write resumes all the time. And I've seen a lot of resumes that go out on LinkedIn as well. And the ones that I see on LinkedIn, they're posting it, and then they're also saying in the same breath that they're so frustrated because they can't find a job. Looking at their resume, I can tell you why. Because a lot of them are putting out so much information that they don't even need, going way back years and years. All you need to go back is 10 or 15 years, guys. That's it. That's all you need. If the employer needs more, they'll ask you for more. But the point of the resume is to say, here's a snapshot of who I am. The point of the cover letter, and ignore those people who say, oh, you don't need a cover letter. People don't read those. People don't read form letters. People do read cover letters that tell a little bit more about you that you couldn't put into your resume. Like the fact that you're organized and that kind of thing, right? All the other little detailed things. If I see organized on your skills list, that's a big no for me. Why? Because organized is a soft skill. It's not your hard skills. Your hard skills are going to be the ones to go on that skills list, right? So this individual here working in the dental office, they would put the electronic medical record that they used in the dental office. So that way okay, we have somebody who is familiar with the electronic medical record. You know, it's a thing, guys. You have to use strategy when you're trying to get in, right? And that's just one of those things that you have to know when you're trying to get into this industry. Again, other people's experiences are not yours. Don't listen to the naysayers. Don't listen to the people who are negative. And if you have negative people around you, you need to get away from them as quickly as possible. I know for myself, on LinkedIn, I have followed maybe 2 people, but because there's doctors, and you know, I'm very respectful of their work, and I like what they do, and they have a lot of really good information. But people connect with me on LinkedIn because of the show, and then of course because their connections are connections with me, and so then everybody sees everybody, and so everybody's just connecting. So I do see a lot of things on LinkedIn. I did see one lady. She was forever complaining, and I literally blocked her because I was so tired of hearing her complain. And every time somebody tried to help her or, you know, give her a little bit of encouragement, she thought of every negative thing to say to that person because she wanted to be negative. So don't be negative. Whatever you do, don't be negative about your experience and your journey into trying to find a job in medical coding. Because again, like I've always said, it is possible. It's just that a lot of times people don't expect that it's going to be as difficult to get the jobs that they think, you know, right away. And then sometimes these schools set the individuals up with unrealistic expectations, especially when it comes to salary. You know, we don't talk about money and specifics on my channel. Never have and never will, because that's not what my channel is for. My channel is about medical coding and the field of medical coding. And every place pays a different amount of money when it comes to their hiring process, you know. But if you're somebody who wants a ridiculously high amount of money and you can't pass an assessment test and you've never had experience as a medical coder, you might want to think about your priorities there, and you might want to kind of like reassess, you know, why are you trying to get into this? I have always told people never ever get into medical coding for the money. While the money is very good, it is not worth it to people who can't find joy in it. And when they can't find joy in it, it kind of spreads to other people. They tend to be the most miserable person at the office, and they want to sit there and complain, and they want to just collect their check and go home. And that's not what this industry needs. This industry needs individuals who care, because at the end of the day, what we do impacts the patient. Most of all, it impacts the patient. And there's a lot of patients out there who have out of control medical bills. And if we actually looked at some of those things, you know, you might be kind of surprised at the things that you see that they were billed for. But that comes from coders sometimes not knowing things. And again, this is why I say we have to really love what we do. Because if you love what you do, you never work a day in your life. I've said that since the beginning of my channel. I've said that. And it's true. It's a very true thing, you know, because we only get one rodeo. That's it. This is not a dress rehearsal. All right. Whatever you do in your career and however you see your career is how you're spending your life. Don't spend it doing something that you'd be miserable at because you want to chase the money. I've never chased the money, and the money has always found me. I'm just saying. So, you know, with that said, tomorrow I will be doing my live at 7:30 p.m. Central Standard Time, 5:30 p.m. Pacific Standard Time, and 8:30 p.m. Eastern Standard Time. So I hope to see all of you there. And if this video helped you, I hope that you will like, subscribe, and share. And I will see y'all next time. Bye.